The Ministry of Health is back under the spotlight, and once again for all the wrong reasons. The United States has suspended direct funding to the Ministry of Health. Reason?
And we're doing this because of our ongoing concerns about some of the accounting procedures and processes and some of the reports of corruption that have emerged.
Indeed, the allegations of corruption have been like the proverbial dark cloud that hovered over the ministry for the better part of last year. The biggest one of them involving the loss of some 5 billion shillings in a scandal that shocked and shook the nation. These reports were initially disowned by the government, despite the report coming from within the ministry itself.
It's very difficult for me to say whether the money was lost or not, unless I did a forensic audit.
My officers had nothing to hide. We have followed up to have this completion.
To the best of my knowledge, I don't think somebody can manipulate information. I don't think so.
The internal probe into the scandal revealed an intricate web that saw the cost for certain projects inflated. Other malpractices were also noted.
When we went to the departments, they have payments which are pending. But when we look at the expenditure, the IFMI's expenditure in the headquarters, the funds were exhausted.
Amongst the areas affected by the scandal were the government's flagship project of free maternity program, anti-malaria prevention, as well as the construction of facilities that had not been planned for nor budgeted for. But the 5 billion shillings scandal wasn't the only one that hit the ministry last year. In October of last year, the ministry was asked to refund some 160 million shillings to the Global Alliance for Vaccines and Immunization, Gavi. This money had been disbursed for immunization programs, but the ministry couldn't adequately account for its use. It was also pushed to task to explain the whereabouts of over 700,000 vials of vaccine. As per the script, the government promised stern action that seemingly hasn't been undertaken.
That report will give to the relevant authorities to be able to take action. Some are administrative. As a ministry, we might take those administrative decisions where people are available.
The trail of corruption stretched far back to May of the same year. A scheme to defraud the ministry of some 18.2 million shillings in fictitious payments of vouchers for supply of stationery, chemicals and reagents to the National Quality Control Laboratory was unearthed. Investigations, however, revealed massive loopholes in the ministry's accounting processes that allow for the siphoning of public funds. It now seems that these same inefficiencies have caught the attention of one of the key donors to the Ministry of Health, hence the current suspension of aid.
The ministry takes some actions and steps to improve its accounting procedures and processes and to clarify certain matters. I hope that we will be able to resume that technical assistance.
Although the U.S. government says that the amount it has frozen in aid to Kenya is just a small portion of the Ministry of Health's budget, many will be hoping that this action spurs the government to speed up its investigations and eventual prosecution of those who will have been found culpable of engaging in the mega corruption scandals at the Ministry of Health. Brenda, Wanga, NTV, Nairobi.